if you want your hair transplant to be successful, you need to know how to sleep after the surgery. So the post-op care after transplantation is really, really important, especially during the first 2 weeks. That's the time when the follicles are actually going to settle in and make connection with the blood vessels, and that's how they survive. So when it comes to sleeping position, actually people worry about, oh, how should I sleep this way and other way, but it doesn't really matter which position that you sleep on as long as you protect the graft area. Meaning, if you're gonna sleep on the side way, make sure that if you put some hairs on the corners, make sure either pillow or the blanket does not rub against the graft area. And if you're gonna sleep on your back, that's totally fine, as long as if you don't have any, let's say you have planted hair in the crown, the vertex area. But if you're gonna sleep on the back, that's fine, as long as the pillow does not rub against the graft area. Same thing with sleep on your stomach. You can do that as long as if you didn't have any, let's say you have planted hair in the hairline. If you're gonna sleep on your stomach, make sure that pillow or anything doesn't really rub against the hairline. So when it comes to sleeping position, whatever position that makes you comfortable, but make sure that nothing really touch the graft area that you have planted the hair.
Yeah, and I think if we can summarize really what you just said, also what Dr. Nam just said, is protect the transplanted hair where the hair was transplanted to. Don't put pressure on those areas. Correct. Where the hair was taken from, you need not be concerned. Correct. So wherever they were transplanted to, that's where you have to protect. If it's frontal temporal, says it's up here, those areas you don't want pressure, blanket running. But the donor area, there's no.
Exactly. Here are some tips to protect your grafts while you are asleep. So after the transplantation, first couple nights, it is a good idea to use neck pillow or travel pillow to secure the head, moving side to side during the sleep, making sure that nothing is rubbed or disturbed on the graft area. And also keeping your head a little bit elevated using extra pillow will help you to keep your swelling down during the first couple of weeks.
So the gravity of a head being elevated, the upper body being elevated a little bit will allow any inflammatory product fluids to drain downward and not go upward to cause more swelling in grafted area. A couple of things to avoid or be aware of after your hair transplantation is to avoid excessive alcohol. There's a couple of reasons for that. Alcohol can dilate the blood vessels, and it's been shown that sleep is a little bit more disruptive if there's a large alcoholic intake before sleep. People might think that they're going to go to sleep faster, which might be the case, but after a very short period of time, there's a lot of tossing and turning and disrupted sleep. With excessive alcohol consumption could cause you to put pressure on the grafted areas and increase the failure possibility. It should be clear that clean bedding should be used, clean sheets, nothing that's dirty, and change them as needed as the days go on after your grafting procedure. But some people might think that wearing a hat may protect the grafted areas, but this is not the case, because you're going to have more movement with a hat that you're not going to be aware of because you're going to be unconscious sleeping. You may have a bandage. You will have a bandage of gauze going around the head, mostly over the donor site, to minimize any bleeding of that site. So that's going to be what you're going to be wearing the first night, but nothing other than that bandage. No hats are recommended to sleep with after hair transplantation.
When can you sleep normally after transplantation? After 2 weeks, you can resume all your activities, including sleeping positions that you used to sleep on. After 2 weeks, the follicles are pretty much embedded and settled in to your scalp. So it is safe to resume all your routine, including your regular sleeping position as well.